My name is Onome Asagbra. I was here in less than a week. I came here and it was really tough for me to walk, just like you can see me. And in less than 1 week, my quality of life has improved. I can walk a lot better, I can sit, and I can move around. And that's because I just finished a surgery, a minimally invasive surgery by Wockhardt. And it was such a lovely experience that in less than 1 week, I have so much to say. After I traveled and came back from a trip, and I discovered, having taken a road trip, I discovered I was having immense pain sitting down. Worse was when I tried driving. I found out that I would come out of the car sometimes screaming out. My boss recommended Wockhardt to me, and I really like the idea because the new technology and the new method for which they performed, what they told me was that with the minimal invasive surgery, it was such that I would be able to get back on my feet in no time. I felt, wow, I would like to really get back to my life as quickly as possible rather than take a couple of months or years to even try and start struggling to walk and all that. I was taken on an ambulance, and of course I needed to be, because at Wockhardt almost immediately they started investigations. I was amazed when I saw the equipment that they had. I had never seen an MRI like that. Beautiful thing about Wockhardt is you have an assembly, a team of doctors, nurses, even the stewards, and the cleaners, everybody just being very friendly. They smile at you and want to make you feel at home. I was pleasantly surprised at the way they took care of me. There was a lot of personalization to it. There was a lot of personalization to the meals. The nurses were on call, were ready to answer.
His MRI did show a very large disc prolapse at the lumbosacral junction, and that disc had actually inferiorly migrated and was pinching the nerve root very badly. The way we do these operations is we do all of these operations in a minimally invasive fashion, where we make an incision that's just a little less than an inch, and the skin is the only thing we cut, and with a series of tubular dilators we retract the muscle, and we just go exactly to the point of target. We shave a little bit of the bone, and in his case we saw that the whole nerve root had been stretched and pushed up by the disc, and the disc was pretty stuck to the nerve root, and it had even actually migrated medial to the nerve root. Most often it's lateral to the nerve root, and with our micro instruments we could manipulate the disc and remove two large fragments, following which the nerve root was completely lax and very free, and there was enough space for it, intraoperatively suggesting that there's no remaining compression. We don't put stitches, we stitch everything subcuticularly inside, and he was actually ambulated, gotten out of bed within 2 hours of surgery. His pain, he said, was 90-95% better.
That same day after the surgery, I could literally use my 2 legs unaided. I think that was one of the things that really got to me first, because I went to the loo and I was able to use the loo myself, and I felt, wow, so I can walk on my own.